Right. Hi, my name is Justin and I'm from PD10. And today I'm going to talk about what is oxygen therapy. Right. Oxygen therapy is used when there is a few problems or disorders such as hypoxemia, or when the patient is having increased work of breathing, increased myocardial work, or having myocardial infarction, or also known as heart attack, pulmonary hypertension, pre-oxygenation induction and difficult intubation, pre and post suctioning. So if the patient has phlegm or needs suction, then we would provide oxygen therapy. And post-operation, especially in abdominal and chest surgeries. And oxygen therapy is also used in decompression sickness, gas embolism, gas gangrene, and carbon monoxide poisoning. So decompression sickness can be because of diving, like when they go for diving and they're inexperienced. So they might need this oxygen therapy to help them to regain back to normal. Anemic hypoxia, and also if patients, especially those in the hospital, have pallor or cyanosis, lethargy or restlessness, which is tiredness, and if they have excessive use of accessory muscles like nasal flaring, intercostal or sternal recession, and also tracheal tug. Okay. Next, when do we need to use? So there is two, which is acute and chronic. So acute is medical emergencies requiring high concentrations of oxygen in all cases. Sepsis, major trauma, cardiac arrest, and during resuscitation. So normally this is during CPR, which we will use the bag. Anaphylaxis, carbon monoxide, and cyanide poisonings. Transfusion-related acute lung injury, or called as TRALI. Medical emergencies which may or may not require oxygen administration, such as asthma, bronchitis, acute heart failure or heart failure exacerbations. So like I said, heart attack earlier, pulmonary embolism. For chronic, it will be COPD, chronic obstructive pulmonary disease, cystic fibrosis, pulmonary fibrosis, and sarcoidosis. And next is to the oxygen delivery devices. So it's grouped into two different types. The first one is low flow oxygen delivery system, and the second one is high flow oxygen delivery system. So I will explain what is low flow oxygen delivery system. So these are the examples, which is the simple face mask, non-rebreather face mask, or mask with oxygen reservoir, and one-way valves, which aims to prevent reduced room air entrapment, nasal prongs, tracheostomy mask, isolate, and nasal cannula. So the first one is nasal cannula, which consists of a small bore tube connected to two short prongs, which is this one. They are inserted into the nose, or called as nest, to supply oxygen directly from a flow meter or through humidified air to the patient. And it can be used for short or long-term therapy. Example is COPD patients, and it's best used with stable patients who require low amounts of oxygen. So the advantage is able to provide 24 to 40% of oxygen, and it is very commonly found. And it is convenient as the patient is able to speak and eat while receiving oxygen, so they can perform daily activities. And it is low cost, easy to use, and disposable. However, the limitations is that it is easily dislodged, so it can easily be knocked by the patient accidentally, or it can be loose sometimes, and it might cause a deviated septum or polyps. Next, this is the simple face mask. So simple face mask is a mask that fits over the mouth and the nose. So this is like the whole face, and it consists of exhalation ports, which is holes on the side of the mask for the patient to exhale, as these oxygen masks only provides oxygen, so which is only more for inhalation. And the mask is held in place by elastic around the back of the head, and has a metal piece so that it will fit better for the patient. And the humidified air will be attached if the concentration of the oxygen is too dry for the patient. Advantage is that it's 40 to 60%, which is higher compared to the earlier one. And the flow meter, it can be used to provide moderate oxygen concentrations, and is slightly more efficient. And it is readily available in most hospital units, and it can provide a high oxygen scale for patients. However, the disadvantage is that it is difficult to eat with the mask, as you can see here. So you might need to take off the mask when you want to eat or drink, or when you want to speak. And some patients will feel claustrophobic, as it's quite a big mask on the face. Next is the face tent. So this face tent covers the nose and the mouth, but does not create a seal around the nose like the earlier face mask. This one can provide 28 to 100%, so it can provide quite a high concentration of oxygen. And it also has moisture for the patients who may have facial burn or broken nose, or who are claustrophobic, which is one of these disadvantages earlier. And sometimes it will be, the disadvantage is that it is sometimes difficult to achieve high level of oxygenation with this mask. Next is tracheostomy mask. So the tracheostomy mask is normally used for patients who just went through a tracheostomy, and it is designed to fit over the stoma and is secure to the neck. And after putting the tracheostomy mask, they will attach the tube to the oxygen tank and turn the oxygen level to the desired amount. Next is the isolate, or the known as incubator. This is for premature and newborn infants. So it provides controlled temperature, humidity, and oxygen levels, and also have the armholes so that the infant can be reached without disturbance, and is a secure environment for the newborn infant. Next is the high flow systems. So there is the ventilator, high flow nasal prong therapy, HFNP, partial rebreather, non-rebreather, and venturi mask. So first is the ventilator. So ventilator is a machine that provides mechanical ventilation by moving breathable air in and out of the lungs. So it's able to take over for the patient who is unable to breathe by themselves, or is not breathing insufficiently. So for example, is like COVID patients, or patients who are in a coma, so they're unable to breathe by themselves. So the ventilator will breathe for them. Next is HFNP, or humidified high flow nasal prong. It is a non-invasive one, so it is more for the outside type of respiratory support, and it is a bridge between low flow oxygen therapies and CPAP. So we don't need to intubate the patient to achieve the same amount of oxygen concentration. So we can reduce any complications that come with intubation. Next is the non-rebreather mask. So it is like the oxygen mask in the door flow, but this one has a bag with it. So as you can see, it consists of a simple mask and a small receiver bag attached to the oxygen tubing connected to the flow meter. So with the rebreather mask, there is no rebreathing of exhaled air. And on inspiration, the patient only breathes in from the receiver bag. And on exhalation, the gases are prevented from flowing into the receiver bag, and it's directly through the exhalation ports located near the sides. And the advantage is that with a good fit, you can reach 60 to 80% of the inspired oxygen, and it is able to deliver a high amount of oxygen through the flow meter, which is 10 to 15 liters per minute. And the flow rate must be high enough to ensure that the reservoir bag remains partially inflated during inspiration. Next is the partial rebreather mask. So this one is has a higher concentration, 80 to 90%, but a lower flow, which is 10 to 12 liters compared to the earlier non-rebreather mask. And this is normally used short-term for patients who require high levels of oxygen. And the disadvantage compared to the non-rebreather mask is that there is no one-way valve. So the expired air is able to mix with the inhaled air. And like in the low flow therapy, the mask is hot and confining. So it will interfere with the eating and talking, and also might cause the claustrophobia. Next is the venturi mask. It is considered a high flow oxygen device. This is because it is able to give a high inspiratory flow at a specific oxygen flow needed by the patient. And it is also attached to a air entrainment nebulizer to provide humidification and oxygen therapy, so the patient will feel as hot and stuffy. And this is the references. So Wikipedia and some other references such as the RCH Australia and nrbi.nih.gov. So this is my presentation on the oxygen therapy. Thank you.